Joining us for an update, Minister of Health and Thunder Bay Superior North MP Patty Hajdu. It's James with Net News Ledger joining us for our weekly update on COVID-19 and other issues in Thunder Bay Superior North is Minister Patty Hajdu, the Canada's Minister of Health. Welcome back.
Thank you very much, James. Great to see you. It
has just been a week. Almost everybody I'm talking to is feeling tired. I mean, we got the rain out there. April showers may bring May flowers, but this has been really kind of rough the last little bit.
Well, I think it's because Canadians have made such tremendous sacrifices. We can actually see the finish line. That last bit is just, hard. It's hard to finish off this race. And of course, Canadians, like I said, people in our region, we've sacrificed so much. And I guess what happens next in terms of what, how we proceed is very, very important. We're vaccinating now here in the region. We've got a higher rate of vaccination than the rest of the province, actually. And we are starting to see infections go down, for example, in long-term care, and deaths go down. I mean, those are good signs. But it's this last bit that's so difficult, I think.
Now, we're in Ontario now. We're on a stay-at-home order and a provincial lockdown, and there's some confusion there. That's a provincial issue we're trying to deal with. But I guess one of the stories is for everybody is let's just treat each other with kindness and respect.
Oh, absolutely. Listen, for sure. I mean, people are tired, as you pointed out. People are exhausted and scared and anxious, and I've been receiving lots of calls about people wanting to get vaccinated, waiting for their time, curious to know why certain folks are going first. And all of that is so understandable. I mean, it's a tough time. But to your point, I think what will get us through this is really trying to remember that kindness to one another and that compassion for one another. And to really see that, the vaccination that's happening in our region is actually doing two things. It is protecting the most vulnerable, and it is bringing down the infection rates. Look at where we were even just a couple of weeks ago and where we are today. And that's a heck of a lot of hard work by a whole bunch of community partners, but also a really great start in our own regional vaccination program.
Now, there's been a little bit of discussion on some of the vaccines that are out there. The Moderna seems to be doing well. Other vaccines have people a little bit confused. Can you let people in our listening audience know what process is it that vaccines get approved to be used in Canada so that they are safe?
Yeah, so we've got a special approval process right now called a rolling regulatory review. It's a pretty complicated word, but it just means that we have expedited, we made it a lot faster to be able to approve vaccines, but it doesn't mean that there's any corners cut. So we've got, folks attached to each vaccine candidate who are reviewing all of the data on how well it works according to the science and the data that the manufacturer submits, the safety data of the manufacturing site, and even the batch data. What does each batch, what is it comprised of? All of that data is analyzed by Health Canada, and only when they're satisfied about the safety of the vaccine and that it meets what the pharmaceutical companies say it's doing, do they actually approve that vaccine for use in Canada. So we can be sure that that is what's happening. The other thing is that Health Canada also reviews reports on a regular basis of any adverse effects of vaccines and regularly reviews new data that emerges, not just from the company, but also from other external research. And that is always under review by Health Canada folks, and especially with these new vaccines, so that we can really understand as we increasingly vaccinate Canadians, how they're doing in a Canadian context, and make sure that we're keeping our eye on the safety of the vaccines.
One of the questions that I've had from a couple of our readers and viewers, some of the people with their parents at home that they're taking care of are wondering, are there any rules that require like first responders to have vaccines? And what can someone do if someone, can someone restrict someone from coming into their house without having had a vaccine if they're one of the care workers? I don't know if that's a federal issue or if that's
That would be a
provincial.
provincial issue, but listen, here's the thing. I would say healthcare workers are some of the safest people in terms of interacting with others. They all, first of all, have a high degree of training about how to protect themselves and how to protect the people they serve. I'd also say that they're wearing the appropriate protective equipment and they're taking care with all of the knowledge that they've gained in their training. So eventually, certain settings may require certain requirements around vaccines. For example, children that go to school now, as you know, are required to be immunized against things like measles and mumps and rubella, common childhood illnesses, and your child needs to show proof of vaccination to enroll in school. You might see that with COVID-19 vaccines as we start to have more access to vaccines around the world. But right now, the best thing I think people can do to protect themselves is to act as if everyone's unvaccinated, because we're still gaining real life knowledge about how these vaccines work and how effective they are. And we know that they're not 100% effective. Not even the best ones are 100% effective. So it's important that we still treat all of the folks in our community with the utmost respect and protect each other against COVID-19.
I think one of the messages that you have shared repeatedly in our discussions in the past year is this is a tricky virus, and it is. And these variants are becoming increasingly tricky.
Yeah. So the variants are pretty scary for everyone. There are some that are less scary than others, but certainly we know, for example, that for example, the variant first discovered in Brazil, the variant first discovered in the UK, in South Africa, they're all slightly more certainly more infectious. That means more people will get sick in a household if one person has one of the variants. That is, alarming, obviously, because, of course, the more the spread, the more strain our healthcare systems face, and the higher likelihood we'll have more people die of COVID-19. The other thing scientists are watching really closely are, do any of these variants create less of an immune response for the vaccines? It's really important that we protect those vaccines. They're one of the best tools that we have to come out of COVID-19. And the worry researchers have is that some of these variants could be vaccine escapant is the word that they use, meaning that they're not effective. The vaccines are not as effective against those variants. Now, variants they don't just develop on their own. They develop when the virus is allowed to circulate freely and allowed to grow and mutate. Viruses are like other living beings in that they look for an advantage to continue to survive, and in this case, infect individuals. And so it's super important. That's another reason why it's important that countries take COVID-19 seriously and control the spread in their own countries.
Now, shifting things a little closer into here in Thunder Bay Superior North, you've had a couple of very, very positive announcements. What do our readers and viewers need to know?
Well, we were talking about FedNor announcements and New Horizons announcements, both of them around supporting the region. So FedNor announcements to make sure that throughout the region, there's an opportunity for economic development. We have a whole list of projects funded, and New Horizons supports for programs and company or organizations that serve seniors and keep seniors connected. Of course, super hard to do even in non-COVID times. And so I had a great chat with many of those providers today about the work they're doing to keep seniors connected during COVID-19, which is challenging, but they're doing it, and they're doing an amazing job.
Minister, I want to thank you again for taking the time to share with our readers and viewers. We'll talk to you next week.
Talk to you next week, James. Take care.
To keep up to date, you have to subscribe. You have to hit that like button and hit the notification to stay in touch.